I think we underestimate how much work goes into these vendors, right? Have to choose their products, and sometimes it
Yeah,
is very subjective, right? Of course it's subjective, right? But they're trying to, it could be hit and miss sometimes. It's like, okay, what's the next one going to be doing? What's my competition going to be doing as such? How do I
yeah,
get remembered? So there has to be a lot of thought put into this as well, right?
absolutely. And that's part of the reason why we did this Tchotchke Awards is to
Yeah,
show appreciation, to give them
yeah,
some more, to learn more, give them
yeah.
more exposure. And absolutely. When you think about it, what is it? 40 to 60% of drug development is outsourced. And the DIA exhibit hall is one of the best indicators of that,
Yeah,
at least from like preclinical through up to around commercialization. And if all of the vendors there suddenly disappeared, drug development would come to a halt.
it would be halted, right?
It
Straight
would come
up.
to a halt. So yeah, I agree with you. I think it's a tough job, but
It's a
somebody's
tough
got to do
job.
it.
Yeah,
And
completely.
this is Sheila Mahoney. I am a cross-functionalist, drug development expert, also the architect of this Tchotchke Awards game slash competition or whatever we're calling it, along with the good folks in the professional development community.
But anyway, this exercise was a neat way to foster a very disarming conversation and to actually learn, ask open-ended questions, and it's without any pretense, right? Of like trying to focus on a specific objective. So great opportunity to meet people and network, learn about different businesses that I probably wouldn't even focus on.
I felt like the exhibit hall, at least the row I was looking at, I thought most vendors were really knowledgeable about the product or service they were selling or wanting us to learn about. And most of them showed real interest in the sessions that were taking place, which I thought was great. Um, I was really surprised to hear about the interest. I discussed our session on including drug development professionals in trials with a few of the vendors, and they were really interested in that subject. So I found that surprising.
Yeah.
So that was great. Yeah.
Caught my attention are the ones that are on the cutting edge, trying to integrate AI into their processes. So I think that was interesting, learning about how these companies are moving forward. Part of the culture change going on.
Interested or maybe surprised by how many different ways people are looking at it, right? Like there were some virtual reality vendors there, and I was surprised by how you could put on a pair of virtual reality goggles and start manipulating molecules. Iron Man, the movie where Tony Stark starts like pulling things out of the air and making
Yeah,
things. And that effectively was what this was in a way. With these VR goggles, you could reach out and it had like a little click button. And so,
that's incredible. I missed that.
the future is here in a real way. It's like, oh my goodness. I love what I'm seeing, like how things are kind of moving forward. And I imagine what this might mean for patient interactions and how we do clinical trials decentralized, how we are enrolling people, how we are getting clinical trials to people in rural areas. It's really interesting and it's perplexing and all of those things, right? Because with all of these neat solutions, bigger issues to solve are coming up too, right? So I just think it's so exciting. And I feel like that is why I've stayed in pharma for over 25 years, is because it's just exciting.
The one thing that jumped out, because I did try to talk to, you know, most of them, was there's a company, I can't remember what they're called, but again, I guess if I went through and looked at the map, they basically do data mining and analytics on medical records. So they were talking about going through transcripts, and it made me realize, so my husband used to work in the emergency room, right? And would do a lot of dictation notes that, and I know data gets sold, right? It gets made, the confidential, the identifiable information comes out, but the fact that all of these health records are essentially being scrubbed and sold, and this company is making a living looking for certain types of trends in it. And I'll be honest, it terrified me. I thought it was interesting, but terrifying.
Yeah, I mean, I feel like the rise of real world data and real world evidence, and by the way, it has not really risen to the point where it will, like, it is just beginning to impact industry, is really challenging all of these every area to incorporate data better. And that's where epidemiology shines. You know, I feel like it's a very good time to be an epidemiologist, and the sky's the limit.
Yeah, COVID helped excel us. Oh, you don't study the skin. I mean, people really thought I used to study the epidermis, but yeah, I think that's where the epidemiologists are slow to kind of realize that we actually can now help a more broader audience. When I say that, I have to spread out, because I was sitting in a lecture about clinical trials and writing protocols, and they were saying, well, we need to write in the protocol about things that happen post-randomization and how we're going to deal with it. And my friend and I were sitting there like, that's what we call covariates, and that's what we put in every protocol. And we have methods to deal with that. That's what we do. So then this whole thing of RWE and RW, that's what epidemiologists have been doing for decades. And then now all of a sudden people are taking it and treating it like it's a new beginning. And so there's a lot that can be learned from what we've been dealing with.
There's just an explosion of, you know, every time you turn around, there's a new vendor who says, I've got this interesting data that I think might be really useful to you. You know, there are rare disease vendors who just focus on rare disease, but it's all going to come down to this highly enriched but curated data. So these are data sources that are focused on a particular indication or a particular therapeutic area. And it's not just claims or electronic health record, EMR type data, but it's patient-generated data, you know, digital biomarker data that they're creating at home with a smartwatch or some sort of device that they're feeding into this registry. You know, you've got the oncology vendors like Flatiron and Concert AI and Ontada that are trying to do big business with their oncology data sets and all the, you know, genomics data that they include. So I think he's right. I think that's kind of the next wave, you know, and all these little vendors who just have sort of a piece of the puzzle might end up kind of going away. But